So I think the most powerful place to start in a look back is with the two guests that I had on the show that were the first to undergo gene editing, CAR T therapy, CRISPR technology. You'll hear all of those interchanged, but the therapies are the same. Okay. It's about knowledge. You can go do your homework, but we want you to be familiar with these terms, and these stories are powerful. It talks about, it just speaks to the miracle of genetics, fulfilling the promise of what we were able to do as an industry over 20 years ago by the completion of the Human Genome Project. We put a man on the moon. This is the equivalent of putting a man on the moon for healthcare. Our ability to know our genes, to understand what that means, to find the mistakes, and then to actually act on them through medication that might be targeted to that gene aberration or variant mutation. Those terms are interchangeable, you'll hear. And then ultimately, with these two, to edit the genes. So we're going to jump into this. First of all, I learned from Victoria Gray in her story. You'll hear the pain and suffering that not only Victoria, but also Tom Whitehead. Victoria Gray, episode 3, Tom Whitehead, episode 11. You can find that on our website. But I just learned a tremendous amount about sickle cell disease and beta thalassemia patients and the hardships that they go through in life, the discrimination that they go through in the healthcare system, the pain and suffering. I also learned from Tom the pain that he endured. You can still hear it in his voice. He still chokes up, of almost losing a child to cancer, of this cancer, which over 90% of patients, these kids are cured of, but not his daughter, Emily. Emily did not respond to traditional therapy. And in the end, she had a 1 in 1,000 chance to live and to conquer her cancer. And through gene editing, she did. And in both cases, they talk about how their children gave them the courage to fight and the faith to believe that they could beat the odds and have unreasonable confidence to take action and take the chance on gene editing, the full promise of genetics and genomics. And then we'll hear from Victoria Gray, the first sickle cell patient ever treated and cured with gene editing. Tom Whitehead is the father of Emily Whitehead. Emily Whitehead was 7 years old at the time. She was the first pediatric cancer patient treated with gene editing for her ALL condition. And after each, you'll hear the practical tips to advocate for yourself with doctors, to have a conversation about gene editing, about CAR T, and how to advocate if you feel that this is something that you want for you or your loved one. So let's listen in.
Most of all, what hurt the most, and it was my wake up call. I had began to be tired. I was sick a lot. Going into the hospital, seemed like I was home maybe 2-3 weeks at the most, and back in the hospital. My oldest son behavior, he started to get in trouble a lot at school, just small stuff, disrupting class, shooting paper basketballs, um, being mean to other students, like just doing petty stuff. And my twins, my girl and boy, they was helpers at the time. They would like to help the teacher out in the classroom, and they kind of stopped doing that and retreated inward. So their teachers would know when I was in the hospital. So they would call or text like, "You're in the hospital." I was like, "Yeah, how did you know?" And your kids are acting different. But this one particular day, my son's teacher called and she said, "Victoria, I need you to come to the school." And so I came and she sat me down and she said, "I'm just going to be honest with you." She said, "Jamarius is acting out because he's afraid you're going to die. He don't
Mm.
want to be at school and come home and you're not there." And that hurt me, because at that time, I wanted to die. I felt like my kids would be all right. But hearing and seeing how my life was already causing them those traumas and deep hurt. I couldn't imagine what my death would do to them. So that energized me to look for treatments. While I was there, undergoing testing, I went into crisis. He moved immediately when I said I was hurting, and he can see it on my face. He, I didn't have to explain my pain regimen. He went in, didn't question what I normally took for pain. He gave it to me. I didn't have to overly explain anything. And while I was there, um, that's when he approached me by my bedside and said that the CRISPR trials was opening up. He asked me, have I ever heard of it? And I hadn't. And that's when he began to explain that it would be like going into a book with thousands and thousands of words, finding a word that was misspelled, correcting that word without altering the story.
Mm.
And he's that's what his theory was, that CRISPR would go in, turn back on the switch that creates fetal hemoglobin without messing anything else up in my DNA. So it would be a precise edit. And he didn't make any promises, but he said in hopes it would decrease my crisis at least by 50%. And I gave him a yes.
Wow. So how revolutionary is everything that you just explained, right? So obviously you're an expert on the disease and the CRISPR at this point, certainly. But when you said it goes in and edits fetal hemoglobin, um, that's fetal hemoglobin is um, the dominant, hemoglobin cells present in the fetus. Like when a baby is being, created in the womb, those genetic um, signatures kind of take over to set the course of our life. And it was as if, you know, genetically you were taken back there and corrected your DNA so you don't or no longer suffer from the effects of the sickle cell disease?
Yes. It would turn on the switch, which is BC11A,
Mm,
to signal my body to start making fetal hemoglobin again. And it would be like living with sickle cell trait instead of sickle cell disease. So I would have half hemoglobin F and half hemoglobin S. And with that, that's why he said 50% decrease, at least 50. But when God shows up, he shows out. It took away completely. Since 2019, I haven't had a sickle cell crisis, a blood transfusion, and by the summer of 2020, I was able to take off my fentanyl patch for forever, get rid of my Dilaudid pills and my hydrocodone, so I am no longer on pain medication.
what can they ask their doctors to seek, better care or to possibly, uh, be treated with a CRISPR technology?
One, you can ask your doctors what options can he provide for you besides pain medicine. That's that's the number one question. And if he can't provide anything more than pain medicine and a blood transfusion, you need to be somewhere else.
Mm.
And another
Because he may
question,
not know. They may not
right?
know.
Another question is, if I ask you, or if I let you know that a medicine is not working for me, will you listen and change it?
That's a that is a Yes. Okay. Sorry. that is it sounds simple, but there's a lot of folks and Victoria, you could probably tell us like that just don't ask those questions. They just listen to their doctor because that person is the expert in charge with giving them the relief. But sometimes we need to really question, um, are they partners with us in our care?
Yes. And another question, you can ask your doctor, if you don't know how to help me, do you know of any other place I can find advanced treatments? Because some hospitals are just not equipped. They don't have the equipment or the technology to perform these type of therapies and treatments. So just to see if they're willing to recommend you somewhere else.
Absolutely, because many of these health centers, maybe in rural areas or that are not in the big city, they are connected to larger academic centers or have a line in to know what's going on in those places, like you did in Nashville, and refer you to those centers. But many times they may not even share the news with you because of their perceptions. Maybe you can't make it that far. Maybe you're not interested in the clinical trial. Maybe, you know, any number of things, but it's very important to arm ourselves with the questions and go in and ensure that they're thinking as a partner with us to make treatment decisions. How did the trial go, and what was the healing process like?
Okay, so after he described to us what they would do, then it was time for a consent. And we signed that fairly quickly because the other option was go home and enjoy the days you have left with her. But the next thing they did, they sent her to surgery and they put a catheter in her neck to extract her T cells, and that allows the blood to flow out into the machine and then back in through the catheter after they put her blood into a centrifuge and spun out the white T cells. So they did that around March 6th after we went down there March 1st. And then they gave her the harshest round of chemotherapy that she had received because they had to slow the cancer down so she could survive the 6 weeks that it would take to genetically modify her T cells. And they gave her clofarabine was the name of the medicine, and that completely wiped out her immune system. And then she had to stay in isolation in her hospital room for 6 weeks there at CHOP while they took her cells to the lab and genetically modified them. And then it was a great day for us. You know, whenever Dr. Grupp came in and said April 17th is going to be day one, and we have no idea what's truly going to happen because it's never been tried on a child. So we're going to give her 10% of her own cells back on April 17th, and we'll give her 30% of the cells that we feel she needs on the 18th. And then if everything goes well, she'll get the rest of the dose on the 19th. So it was huge for us because during that 6 weeks, they told us if she even gets a common cold, she can't fight it. It could take her life. So you can't bring germs in the room. And it was very stressful waiting for that to happen. So, but then they did give her 10% of her cells on April 17th, and we allowed, a film crew to come in the room with us because I didn't know any other way to look at it other than, she's going to change the world. So, we want footage of this. So the PR team asked, can we have a film crew follow you that day? And I said yes, and that wasn't easy to do either. But like I said, I'm a positive person. I didn't know any other way to look at it. But day one, she got 10% of the cells, and nothing happened, which is good. Boring days in the oncology unit are good days. And day two, she got the 30% of the cells, and we actually left the hospital and went to my sister-in-law's in Wilmington, Delaware, until around midnight when she spiked a fever. And at that point, we weren't comfortable being outside the hospital, so we went to the ER and waited till morning. And in the morning, she didn't have a fever, felt fine, and Dr. Grupp came in and said, "It's your call, but we feel that this would give her the best chance if she gets the rest of her cells," and we agreed to that. And then we kind of went through the worst part of her treatment. We found out later that every genetically modified CAR T cell can kill 1,000 tumor cells. And when they put those cells back in her body, she weighed around 68 pounds, and 3.5 pounds of her body weight was cancer. So there was so much cancer dying so fast that it overwhelmed her system, and she had what they call cytokine release syndrome, or a cytokine storm, when your immune system just goes crazy. So within 24 hours of getting her last dose, she was hallucinating, she was having severe pain, she was having breathing difficulty, blood pressure difficulty, and they ended up taking her to the intensive care unit and putting her into an induced coma on a ventilator, breathing for her, and she remained that way for 14 days. So very brutal. Um, but We started a blog on day one, and we kept that blog the whole way through. And at that point, it was just asking people to pray for if you pray, or send positive thoughts, and that really helped us through that time. But maybe around the third day on the ventilator, the head of the PICU come in the room, and he said, we're the biggest PICU in the country, pediatric intensive care unit. Almost every child we put on a ventilator gets off. Unfortunately, we don't think Emily's going to get off, so you might want to call your family in. And I said, well, I know that she's going to change the world, so please keep trying to help her, because I'll see you at rounds tomorrow. And he pulled me into the hallway and looked at me like I was the most naive parent in the world. And he said, there's a 1 in 1,000 chance your daughter's alive when the sun comes up. You better call your family in. And I said, okay, I'll see you at rounds tomorrow. And the next day, he came with his group of young doctors and said it's medically hard to explain how Emily's still here, but that's why we never give up on a child. And within an hour of that, Dr. Grupp showed up and said the team and the lab stayed up all night identifying what's wrong in Emily's system. And we found this protein that's 1,000 times higher in her system than anybody we've ever seen. It's off the charts. And we happen to have an arthritis drug. We have 2 doses of this arthritis drug that's never been used on a cancer patient that takes that protein down, and we feel like it could give her a chance. And that saved her life. So that medicine was called tocilizumab, and they gave Emily that medicine, and within hours we were hearing the nurses say, we've never seen a child this sick get better any faster. And they were, and I posted online, I believe I'm witnessing a miracle. And she came back to us then and woke up on her 7th birthday from that 14-day coma. And that would be May 2nd of 12. And then 8 days later, which is 23 days from her first dose of CAR T cells, they checked her bone marrow and she was completely cancer-free.
Can you give, 3 practical tips? These can be questions, resources, or just ways to advocate for themselves, to give them the language and the confidence to advocate for themselves and their family.
Well, that's the first thing you got to do, is as much research as possible. There's so much more information out there now. I mean, when we were looking into it, it was hard to even find anything about it. There's a ton of information. I tell everybody, do as much research as you can. You have to advocate for yourself. What we learned too is the best doctors in the world are never intimidated by a second opinion. If you have a doctor that gets upset um, about or threatened by a second opinion, to me that's a red flag where you want to look somewhere else. But also, we are helping create search engines that the average person can use. A lot of people have no idea, or they get on the government website of all the open trials and you can get completely lost. Like I wasn't able to do it myself, where my wife had the knowledge of how to do that. So we're working with several different avenues on making that thing. If you're in the hospital and you type, my child or myself, I have this disease relapse, an easy way to find a contact person, say at Penn or MD Anderson, Seattle, Sloan Kettering, Johns Hopkins, Boston, maybe closer to where you are. You can find a trial that's open where you say, hey, I want to be part of this. If I'm not going to make it anyway, like the way I would look at it myself is, if I can be part of trying something that it might not help me today, but it might help somebody tomorrow, I would do it myself. But there's a lot of trials out there right now that are working, and they can't find enough patients to get in them. So again, you can check with us. We do everything in our power to try to find a trial. I have a lot of one of the best things that's happened since Emily got better, and we have all this media coverage, is people who probably wouldn't have answered my messages in the past will. So I have access to a lot of people that we just try to ask, hey, here's this disease, here's this relapse patient, this is their situation. Where would you send your child if this is, or where would you go if this was you? And they're really good about getting back to me, because they also care deeply about helping the next patient have the same outcome as Emily.
When I take a look back at the person that I was after having these conversations with Victoria Gray and Tom Whitehead, I know today that I've been changed. I've been inspired. There's something that has been birthed in me that is more determined to get this information out through this podcast. I want to reach someone's mom, brother, sister, cousin, uncle, nieces, nephew, papa, and mama. And just as Tom and Katie Whitehead channeled their passion that they had for fighting for their daughter Emily to get into a clinical trial with gene editing, they had the courage and the passion to take a chance. They are now channeling that courage and passion into their foundation, the Emily Whitehead Foundation, which is raising funds to increase patient access to CAR T therapy, precision medicine, gene editing,